new graduate with a master's degree. Mother Teresa, who dedicated her life to helping the poor and the sick, was asked one time by a visiting American woman of some means what the woman could do or send her or give her to help Mother Teresa further her mission. Mother Teresa, in her soft, very common sense way, told the woman that she didn't need to send her money or goods or supplies, but that if she really wanted to further Mother Teresa's mission, what the woman should do is to go out into the streets of Phoenix, where the woman was from, at 4 o'clock in the morning and find someone who was poor and cold and hungry and sick and convince that person that he wasn't alone. I had been a registered nurse for 18 years. Clearly, I started when I was 4. When I met a nurse practitioner who came to the long-term care facility where I worked, who was very different in many respects from the other providers that I worked with. She came every week and she got to know her patients really well as people. She knew their kids, she knew their grandkids, she knew them well enough to know that when there was some subtle change in their behavior, or their activity, that signaled a change in their healthcare status. In a setting where everyone there was very fragile and very medically complex, her patients rarely ever went to the hospital because she caught their condition changes early and intervened. She's here, she's going to kill me because she didn't know I was going to say this. But when those patients came to the end of their lives, she was with them when they died a peaceful, comfortable death in familiar surroundings with people who loved them around them. That nurse practitioner is the reason I decided to go back to school at the tender age of 48 to become a nurse practitioner. I wanted to be like her, and I wanted to make a difference. In fact, she was my preceptor a lot of the time over the last 3.5 years. I called her my own personal little dictator. And to this day, when I'm examining a patient, I have to laugh at myself because I hear her voice coming out and her phrases coming out of my mouth. She is an Allen graduate twice, so well done, faculty. I'm telling you this story because the entire short history of nurse practitioners, indeed of nursing as a whole, has been one of people seeing a need and filling it. And if you look around at the instructors that have been with us over the last few years, you'll see the same type of people. These are, for the most part, women who could have been had very distinguished careers nursing, but something made them, as mothers and grandmothers in a lot of cases, go back to school, stretch their brains, abuse their bodies, do things that people probably told them could not be done, and imagine new ways of doing things. I'm not going to lie, there have been moments when I wanted to strangle one or two of you, and some of you, I think, should know that you have a very unhealthy obsession with APA formatting. But I'm not a mental health nurse practitioner, so. When I knew I would be speaking here today, I thought to myself, what am I going to say to these people in 3 minutes that they are going to remember? Because honestly, I know what you want to do. You want to get out of here, take off these gowns, take off the shoes. I don't know what else. But what I want you to do is to remember as you leave here that as advanced as American healthcare is, as everyone here has said, a lot of people will come into your practice area over the rest of our careers who feel alone, and they're not all sick. I mean, well, not necessarily. They're not all poor, they're not all people who don't have insurance or anything like that. American healthcare today is a system of uncoordinated silos where experts speak in funny technical jargon and the average person feels alone and afraid and confused. Convince them that they're not alone. When you meet a teenager who is struggling with the changes going on in her body and body image issues and how to live with 1 foot in childhood and 1 foot in adulthood, Convince her that she's not alone. When you meet the middle-aged man who's struggling with the big three, diabetes, hypertension, hyperlipidemia, plus he's got kids who have lost their minds because they're teenagers, and a boss who is awful, and a wife who's finding herself, convince him that he's not alone. You've just spent the last several years learning how to critique and utilize research data, the difference between how a drug affects the body and how the body affects a drug, and what ICD-9 code to use when a 15-year-old girl announces to her mother that she's gay. Oh yes, Julie Ritlin, I remember that case study. Thank you. But I ask you, please, in all of your intelligence and your high-tech competence and your brilliance, don't forget to use the most finely tuned assessment instrument ever invented, your heart and your ears. Use your ears to listen to people, become their trusted partner in their own health care. It's important for me today to leave you out with a trumpet call for change. Healthcare has to change, obviously. We have to start working with people to keep them healthy instead of just treating them when they're sick. We have to enter into their lives instead of asking them to walk and succeed in ours. I know I speak for all of us when I say thank you to all of the spouses, the kids and the grandkids who have had less than the best of us over the last few years. I promise we will learn to cook again. Our dining room tables will look like dining room tables again. I want to thank our employers, who I'm pretty sure wondered what happened to those cheerful, competent, intelligent people they hired, and who were these crabby, scatterbrained jerks that they've been dealing with. Sorry. I want to thank our instructors who have taught us sometimes hand over hand how to think in bigger ways and to see ourselves in bigger ways. I wondered when all this started how I would ever see myself as someone who would direct other people's health care. But our instructors and our preceptors are the reasons why. But most of all to you, my classmates, I want to thank you for letting me feel that I was not alone. You are the best of the best, and without a doubt the smartest, toughest group of women and men, Michael and Clint, that I have ever had the chance to spend time with. The fact that you have completed this graduate degree puts you in the top percentage of nurses anywhere. This gives us all a huge responsibility, and I want you to know that looking at you and knowing that mine and my kids' health care will be what you make of it throughout your career makes me very proud. I'm so proud of you. I made you cry. Reach back and give back and convince other people that they're not alone.
Thank you again, Carrie, and